Hi, this is For Us To Us Black Culture. This is part two. I'm coming back at you because I said I was going to do part two because this is very important information. And it is going, I know one of my listeners had mentioned on the last video about why did she say something about George Floyd and she talking about sleep apnea. Well, George Floyd had a knee in his neck and he couldn't breathe. And 1 in 8 people stop breathing in their sleep. So this breathing, whether it's a knee on your neck or you stop breathing in your sleep, is very, very critical and it's a horrible thing to experience. So I'm going to talk about sleep apnea. What is sleep apnea? Sleep apnea is a sleep disorder where a person repeatedly stops breathing for short periods of time during their sleep. Okay, you have obstructive sleep apnea. That's the most common. And then you have central sleep apnea, where the brain doesn't send the proper signals to the breathing muscles. But the most common is the obstructive. Okay, and how do people get sleep apnea? The major causes of getting sleep apnea is excessive tissue around your neck, okay, like being overweight, thicker neck, and that blocks the pressure to your airway. And that's the number one cause. Okay, then it could be genetics, your bone structure. Some people naturally have like a smaller jaw or a narrow airway, large tonsils or tongue, or a long, soft palate. Okay, that can be inherited and have nothing to do with your weight. Okay, then it could just be aging. Airway muscles weaken over time as we get older, and sleep apnea risks increase after the age of 40 and 50. Okay, and then the sex, because meaning gender, men are more likely to develop it, although women become equally likely after menopause. And nasal congestion, allergies, chronic congestion, or deprived spectrum can contribute to that. Also, any hormonal conditions like hypothyroidism, PCOS, and acromegaly. Not sure if I'm pronouncing. I'm not a doctor, but these are some things that deal with your hormones that can cause the sleep apnea. These can affect your weight, your hormones, and airway tissues as well. Alcohol, sedatives, or smoking can also keep your airway muscles and increase nighttime obstruction. Now, like I said in the first video, I had COVID 3 times. Okay, so it was messing with my respiratory system. Okay, so that can be a cause. COVID was running through here. It was not a misunderstood illness. So it's causing problems. So we don't know. It could be due to that as well. The symptoms of sleep apnea are most common is the loud chronic snoring. That some people, just snore, very loud snoring, gasping or choking in your sleep. Pauses in breathing, like if some people say you stop breathing while you're sleeping. Daytime sleepiness, morning headaches, mood changes, irritability, difficulty concentrating, waking up with a dry mouth. Okay, those can be symptoms. Effects of untreated sleep apnea. Okay, if not treated, sleep apnea puts major strain on the body. And short term effects could be severe daytime fatigue, irritability and mood problems, poor focus and memory, falling asleep while you're driving or even talking. You could be talking, you're talking to some people and they just nod off and fall asleep. That could be a sign or a symptom. Your low sex drive, that could be a symptom. And long term effects, if not treated, can put your body into sleep apnea and increases the risk of high blood pressure, a stroke, heart attack, diabetes, kidney disease, depression and anxiety, weight gain, and shortened lifespan. So these are the effects of sleep apnea, the short term and the long term, because your body is constantly deprived of oxygen. So our oxygen is very, very important, as we all know. Sleep apnea in Black Americans. Okay, we have a higher risk and a lower diagnosis rate. Research consistently shows that Black Americans experience sleep apnea at higher rates. Like I said in the first video, studies estimate up to 25 to 30% of Black adults have sleep apnea. compared to the 14 to 20% of the general population. But we are less likely to receive diagnosis. We are most likely to have severe symptoms, less likely to be referred to sleep studies, and more likely to be underdiagnosed and misdiagnosed. Some research suggests over half of Black adults with sleep apnea may be undiagnosed. So why are Black Americans more affected? Well, we are higher rates of risk factors because of high blood pressure, diabetes, obesity, and asthma and nasal problems. And we have structural and healthcare inequalities. We have fewer referrals to sleep specialists, delays in medical evaluation, less access to sleep studies, and misinterpretation of symptoms as fatigue or stress. Okay, we might just be poo-pooed off. Oh, they're just a little stressed out or, fatigue, and we actually have sleep apnea. So we have to advocate for ourselves. If we're feeling like off, we need to go get it checked out. Environmental and stress factors. Okay, we can have chronic stress where we're more affected. Higher exposure to environmental pollutants and shift work and irregular sleep schedule can contribute to sleep apnea. And why this underdiagnosis it matters is because sleep apnea means that more untreated high blood pressure, we have a higher stroke and heart disease risk, poor mental health, and a shorter lifespan. Black Americans already face higher cardiovascular risk, and untreated sleep apnea amplifies those risks. So this is serious stuff, people. I'm talking about this because 1 in 8 stop breathing. That's to me is a bit, and that's snoring. A lot of us snore. A lot of us overweight. So we really need to be careful. I don't want anybody, not breathing. So, okay, and so we can make some lifestyle changes. No alcohol. We can do regular exercising. We can control our weight. Avoid back sleeping and using a humidifier. And I know it's not easy because I'm struggling. I'm struggling to get to that working out stuff too. It's important as we age and get older. It's important for our life. And also, when I went, they had me go for a sleep study because, like I said, with that COVID, I was having respiratory problems. Now, the doctor did tell me my AHI, which is apnea hypopnea index, was at a 20. Okay. I went for 2 sleep studies. Okay, after I went with one with the mask and all of that stuff, and I was going crazy with that thing. I was feeling like I was claustrophobic. I kept hitting the that thing was insane. Okay, but it is helpful. I mean, if you need it. Okay, but then they told me to try this little gadget. Now this is just a little. You boil it. I ordered this off Amazon. The doctor told me I ordered it. Fraction of the cost of that CPAP machine, not loud enough. You stick it in your arm, right here, and you just sleep with it. Okay, and the doctor called me just a few months ago and told me my apnea went from a 20, my AHI went from a 20, and now I'm at a 3. So he said this little thing is working for me. So don't be afraid, don't be scared. Go if you need a machine, I hope and pray you can get it. There check around and see if they have some type of waiver or some type of money they can offer. I don't know what they have, but if not, try. I'm not a doctor now. You have to consult your doctor and ask them, are you able to use this little puppy here? Because like I said, mine went from a 20 to a 3. So my doctor was like, wow, that's helping you, and I didn't have to get the machine or anything. So I'm saying all of this to say, let's take care of our health. Let's breathe. We need to be breathing. So get it checked. If you find yourself snoring, you find yourself tired, you find yourself with any of these things that I mentioned, please go to a clinic, a doctor, and get it checked out. All right. Always caring about my peeps. Black to the power, baby. See you next time. Thanks for listening.